Mental health stigma, a social justice issue. Sean Wolgemuth. Identification of the issue. Mental health stigma limits individuals' access to care and contributes to social isolation. Hypothesis and operational definitions. Hypothesis: increased exposure to mental health education across diverse cultural contexts will reduce stigma and improve public perception of mental health conditions. Operational definitions. Stigma: negative attitudes or discrimination toward individuals with mental health conditions. Mental health education: programs that inform the public about mental health issues to combat stigma. Cultural contexts: belief and practices that shape mental health perceptions within communities. My interest is driven by a desire for a more inclusive society where mental health support is accessible and stigma-free. Importance of social justice issue. Stigma contributes to negative outcomes, such as discrimination and social withdrawal, making stigma reduction essential. Key psychological concepts and principles. Psychological concepts: social influence, public perceptions, and societal beliefs strongly impact mental health stigma. Perceptions and attitudes. Public perceptions directly impact stigma. Scholarly evidence. The impact of education on reducing stigma. Evidence. Studies have shown that educational programs significantly reduce stigma by addressing misconceptions. For example, Corrigan et al. 2012 found that individuals exposed to mental health education showed increased empathy and understanding toward those with mental illnesses. Additional studies: stigma reduction through education. A meta-analysis by Thorncroft et al. 2016 highlights that public education campaigns can change attitudes, especially if they include personal stories or interactions with individuals affected by mental health conditions. The role of cultural context in mental health stigma. Evidence. Kiermaier and Minas, in 2000, emphasize that cultural beliefs strongly influence mental health stigma, often shaping whether individuals view mental health conditions as medical issues or moral failings. Supporting research. A study by Grohm et al. 2017 found that stigma reduction strategies must be culturally adapted to be effective, particularly in communities where traditional beliefs about mental health persist. Link and Palm 2001 proposed that public attitudes are linked to social power structures, suggesting that in many cultures, stigma may reinforce existing social inequalities. The effects of contact-based interventions. Evidence. Research supports that direct contact with individuals who have mental health conditions can significantly reduce stigma. Studies like Corrigan and Shapiro in 2010 show that contact-based interventions are especially impactful when individuals hear firsthand about others' mental health journeys. Additional findings. Peers and community support. According to Henderson et al. 2014, initiatives that involve peer support and community education yield a lasting reduction in stigma, as they help normalize conversations about mental health. Healthcare setting impact. Koch et al. 2017 found that healthcare professionals who engage in stigma reduction training are more likely to exhibit empathy and reduce discriminatory behaviors. Summary of research insights. Key takeaways: education and contact. Public education and direct contact with individuals affected by mental illness consistently reduce stigma. Cultural sensitivity. Effective stigma reduction requires an understanding of cultural context and local attitudes. Institutional support. Healthcare professionals and institutions play a vital role in promoting inclusive, stigma-free environments. Conclusion. Knack et al. 2017 summarized the importance of addressing mental health stigma through culturally sensitive education. References.